All right, welcome to our podcast dedicated to helping those with endometriosis access proper care. I'm Nicole, the founder of Endo Excision for All, and today I'm thrilled to welcome Dr. Beck Hoehn to our show. Dr. Beck, do you want to introduce yourself and just give a little bit of a background and your expertise?
Yeah, my name's Dr. Hoehn. My first name is Beck.
Okay.
I am based in Los Angeles and I have a specialty in reproductive health. I've been in clinical practice for 10 years and now I'm working on a lot of research around reproductive health. And I also teach on the doctoral level, and I also work as a strategic outreach person for an herbal company. I'm the medical advisor at a place called UVA, which measures urine metabolites to evaluate hormone levels. I have a specialty in acupuncture, and I'm double board certified in acupuncture and herbal medicine, and I also treat using functional medicine.
Thank you.
Yeah.
So before we dive in, can you share a little bit about your approach to integrative medicine and what drew you to working with acupuncture and herbal medicine, especially when it comes to patients with endometriosis?
Yeah, I actually come from a background of the film business. I had been in the camera department for 25 years, and I actually had an injury at work, and the acupuncture was the only thing that got me back on my feet again. And at the same time, I was experiencing a lot of painful periods or dysmenorrhea. And the acupuncturist not only got me back on my feet, but then also cured my super painful periods in a matter of a few sessions. And so I felt so passionate about that transformation that I decided that I felt like I really needed to help my other camera sisters with their own journeys, because it's a very underserved community. And a lot of the people in my community, in my camera community, were experiencing the same things I which was a lot of stress, a lot of fatigue, a lot of pain around my periods. And I just felt like there was a lot of space for access and education so that we can empower more of the people in my community. So after I got my general degree, my master's degree, I also went on to get another degree in research in reproductive health, and then another certification in fertility specifically.
That's a lot. That's really, you have
Yeah.
such a robust background. But it's so helpful because every woman is just,
Yeah.
especially with endometriosis, it's the same disease, but just affects women so differently. So just having such a broad background is so helpful.
Yeah. And it was really interesting to see. I mean, once we can get into this more, this discussion, but it was really cool, like that transformation for a lot of the people. Like initially I went in with this pillar that I was going to serve my specific community. But then what we did was, speaking directly to endometriosis, like we found that so many people were not getting to the diagnosis they needed. And acupuncture and herbs were really a great place for them to mitigate their symptoms before they could find an endo specialist, or and so that becomes really great. And we'll probably speak to this, but in clinical management too, it's really important to have it almost be a collaborative care, right? Especially with endometriosis. So we work specifically with one of my close friends actually is a pelvic floor therapist. And so
Perfect combination.
yeah, totally. And so she does all of her clinics, all of her people are specialized in abdominal visceral massage. And we just kind of take it to the next level and really complement what they're doing. So we have case reviews. It can just even be on the drive home or whatever, so that we're really sharing the process of evolution for that patient.
Exactly like what you said about the tying conventional medical approaches with the integrative approach. So for patients who are, since especially listeners are at different stages of their endometriosis journey, whether they're just kind of diving into it and finding out what endometriosis is, trying these different alternative methods. I know my own experience, surgery is like a total last resort for me. I never had anesthesia before. I really didn't want to do it. And I tried everything. And herbal medicine helped me. I feel like it put off surgery at least for a year and a half for me, in managing my symptoms. Especially just making my periods more regular, lighter. They definitely started coming, instead of being 4 days late every month, I started becoming 2 days earlier, right on time. And just having them be so much lighter. I mean, it didn't take away the endometriosis, still had to have it excised, but it just really helped me manage the symptoms up until I was ready to have surgery, gave me time to find the right specialist, just really just, I mean, and also helped with the post too. Like, I feel like it's just having, taking herbal medicine and different Chinese herbs is definitely helping me, I feel, manage any regrowth from coming back.
Yeah, that's great. And thinking about just moving on, also to think about what we call teams, which is traditional Eastern Asian medicine frameworks, instead of TCM, now that we've kind of gone through a change there. Just really thinking about how comprehensive the medicine is, right?
Yeah.
So you called it under the umbrella of integrative health, but in teams, we're really thinking about culling from all of the different interventions to really support that endo patient. So thinking about self-care and how we can really teach them and educate and them, empower them on how to use moxibustion, which is a warming therapy, to really mitigate that pain response. And then using the acupuncture and the herbs together so that they have this really synergistic effect, right? So the acupuncture is going to be the right hand of the medicine almost, and the herbs are like the left. So they work in this almost salt and pepper combination together in this really beautiful way. So maybe for those of those listeners that can't really get to an acupuncturist all the time, you can always experience, maybe you go to see your acupuncturist during ovulation and at the end of your cycle. And then in between, you really can consider a formula strategy, like phasing your formulas to really complement the phase of the energetic phase that you're in. So in the follicular phase, you would take a different type of herbal selection and point selection, and then complement that with something in the luteal phase.
What exactly, when we're taking these herbs, what exactly is happening in the body that like puts it to work?
Yeah, I mean, it's kind of the same thing as what the acupuncture does, right? So it allows the body to heal itself, basically. It just kind of depends what the herbal formula is and what that treatment looks like. Like, for example, one of the things that you talked about was one of the constituents in a formula is an herb called Yan Huso, right? So Yan Huso is 40% stronger than morphine without the side effects, right? So there's almost like an opioid effect it can have on the body. So it just kind of depends on its true pharmacognosy in its most beautiful form. So like a lot of times with the acupuncture, what we're doing is we're reducing that pain response as much as possible that you get with an endo flare. So we're kind of working on that. And then with the moxibustion, that warming therapy, we're trying to warm and circulate so that we're reducing that pain response as well.
Are there any herbs that you would recommend a woman with endometriosis or who thinks they have endometriosis to try, or like turmeric or ginger or valerian root or any type of like teas, tinctures, capsules? Or would you recommend like sitting down, finding a specialist like you and really catering to the body?
Yeah. Yeah, great question. That's so awesome. I would not that would not be an arena where I would cherry pick and try.
Yeah.
I know, like with a lot of times, it just depends where you are in your endo journey, but like a lot of times we see people where they're like, oh my God, I've tried everything. And like, we get a lot of stage 4 people. And, I got to say, it's really helpful to have somebody that's ABORM certified in our fields, so that they've gone through another layer of certification. And then you really want to make sure that they know what they're doing with herbs, right?
Yeah.
So it's not something that I would try just generally by myself. The herbs kind of really work in tandem. Like, again, that synergy is really important, right? So those tiny little combinations are really important. They're called dui yaos within a formula. So within a formula structure, we have a bunch of herbs that kind of work all together in tandem, right? So a Dui Yao is one combination that two really powerful herbs come together, and they both energetically do these two different things within the body, and then they come together and they deploy this amazing, powerful thing, right? Yeah. So a lot of the herbs, when we talk about endometriosis, are really about that Dui Yao combination. So there's some classic formulas. So we have what are called patent formulas, which are standard formulas that are centuries old. And so those are what we use when we see somebody, and then we establish what their baseline constitution or their diagnosis is. And then what we can do is we can customize it with these Dui Yaos or these single herbs, right? So every endo patient would be different, right? So we would call that in general in TCM pattern differentiation, it's called stasis, right? So, well, what kind of stasis, right? So it can be hot or it can be cold. And so you wouldn't want to give a warming herb like ginger or something like turmeric to somebody that has, heat, a lot of heat in their body, right? So it's just a matter of really looking at, we have two diagnostic tools besides just the interview process. We have looking at the tongue and the pulse together and really seeing the person in front of us so that we can really create a great customized treatment plan.
Are there any safety considerations or different things to look out for, especially for a woman with endo who's meeting with a specialist and with an herbal specialist, and to make sure that they tell the specialist that they're taking specific medications.
Of course, all the time.
Lupron or Alyssa or metformin, different birth controls, that they could have negative interactions if the woman with endo is not being fully communicative about what else they're taking.
Yeah, I mean, that's part of the intake form, right? Like anywhere you go, I mean, obviously, the responsibility is not just on the doctor to create collaborative care. It's also on the patient to really report, the reporting.
Yeah.
And for sure, I mean, the herbs are very, very powerful. And some of them have a very estrogenic effect, right? So we wouldn't want to use those herbs when we're in the middle of the estrogenic aspect of your cycle.
Yeah. There's something that comes up, I just on social media a lot. And I feel like anytime I'm out at a endo community thing, a lot of women are talking about evening primose oil as that's something to be constantly taking. But then I also see a lot that it can interfere with if you're on different medications like Zoloft or Lexapro.
Yeah, for sure.
So can you kind of do some myth busting with evening primose oil?
Well, I don't prescribe antidepressants, so I wouldn't be able to speak to that contraindication. I can speak to the effect of evening primrose oil in the sense that it's a GLA, so it's got a lot of gamma-linolenic acid in it. A more concentrated form of that would be borage, which is great. And I actually suggest growing that specifically and chopping that up and putting that in a tea. But yeah, I mean, always check. Obviously, don't just start randomly taking supplements or herbs. You have to check for contraindications.
And then we're talking a lot about the complementary therapies, and that have made a difference. And acupuncture is definitely a huge game changer for me personally. And like you said, many patients and yourself. So let's switch gears a little bit. And can you talk a little bit more about how acupuncture specifically helps with endometriosis symptoms?
Yeah. So acupuncture, like I said before, so do we need to talk about how acupuncture works? Should we talk about that a little bit? Or have you had an acupuncture son? Or I don't want to mansplain your community. Sorry.
I love it. No, I love it.
Okay.
I love it. No, let's definitely talk about it.
Let's do it. Let's do 1 to 2 sentences on what acupuncture is, because we just started
how it works.
Dive right in, kind of. So we kind of talked at the top of this conversation, we talked about the TCM or Teams umbrella, right? Which are all those kinds of spokes of the umbrella where we have all these different types of interventions, right? Moxa, herbal medicine, abdominal massage, acupuncture, all of those things. So it is really a complementary, truly a comprehensive complementary medicine that helps you lead a better life, right? And acupuncture is one of those tools where when you think about acupuncture, what we're doing is thinking about all of the systems that you know through conventional medicine, the circulatory system, the nervous system, the musculoskeletal system, all of those things combined. Think about those as a combination of systems that work all together in what's called a meridian system. A meridian system is like a channel. And I always say, because I live in Los Angeles, it's like a freeway, right? An energetic freeway. And all along the freeway, there are these exits where traffic or chi energy, a person's energy field can get stuck, right? And so the acupuncturist knows where there's a propensity for those blockages to occur and knows how to clear that chi so that there's the free flow of chi along the meridians so that the body can really learn how to energetically heal itself, right? So that's basically how acupuncture works, is to balance the system. So we know that we can reduce the stress response, we can improve circulation using acupuncture. And I talked about this as well, but reduce that pain response overall. And that is huge for endo patients, right? So specifically in a really bad flare. And I will say this just for your listeners, the needle is just one way that we tune chi. And you can use acupressure on those points.
I was just going to ask about that because I remember I started acupressure like 12 years ago, but I started doing acupressure because I was scared of the needle. And eventually did like one or two, and like now I do a full body coverage needle type of deal. But I started out with acupressure, so I was wondering if we could talk more about just acupressure, how impactful that could be, and then
huge
the extra impact from adding the needles.
Yeah, so acupressure is really, particularly actually when we're thinking, not to get so nuanced, but all the way down the spleen meridian is really great there's a ton of pain points on the lower inner part of the leg that can be really lovely if you massage them for when you have endo pain. And it's really great. It's part of how we support people. I'm always about making sure that people have things to do when I'm not there is my biggest, I want you to go out, self-heal, self-regulate. But I work in tandem, right? That being said, every once in a while, an endo patient will come in for a tune-up, once a month, twice a month, maybe. But we get them to a state where they can manage their symptoms by themselves. And that's really, really powerful. And of course, it's not just hanging the hat on the acupuncture alone, right? There's a lot of nutritional interventions and other things that can happen. But for those of you that live far away from an acupuncturist, learn the acupressure points for endo, and you will have at least another tool in your toolbox.
For patients who are just starting out, have never done acupuncture before, is there an amount, a frequency that you would recommend just starting out, and then, like you said, eventually getting to the point where a patient come in for a tune-up once a month or every other month?
Well, this really depends on the provider. So generally speaking, for a really extreme case, you would probably want to see them twice a week for about 2 weeks, maybe. After that initial visit. Generally speaking, I see somebody for about once a week for three cycles. So, and then after that, I do a reassessment and see, and it is very collaborative. It's all about meeting the patient where they're at. And then after that, we usually get to a twice a month cadence if they're really good with their herbs or really good with their diet and kind of working on those things by themselves. I mean, they have to be part of the equation too, right? I mean, there's sadly with endo, it's a lot of work, right? As you know,
full-time job.
It's a full-time job
on top of your full-time job.
Yes. Yeah. And it's hard to explain. It's very isolating. I mean, I'm sure you've already talked about this on the show, but nobody can understand endo pain unless you've been through it, right?
Yeah, unless you deal with it.
Yeah.
Is there a minimum amount of time that you would say to go? Like no
I just don't think
less
you're,
than
I
two
mean,
times?
yeah, this is a good question. There's a lot of research on dose, acupuncture dose now in whole systems medicine. I would say in the beginning, at least commit to once a week for at least a month, because
Right.
you're not going to let the acupuncturist isn't going to get anywhere with you. Like there's not going to be able to track the pain scale and like
Yeah.
do a really good assessment. And you're not giving it a Bronx cheer, college try at that point.
Yeah.
Yeah.
For someone who's starting out with acupressure and scared to actually go through the acupuncture process with the
Yeah.
needles, what would you recommend as like a first section if they're like, okay, I'm ready to try a needle? Like, what
Yeah.
would you recommend?
Yeah. We have a cool PTSD patient right now. So, they're terrified of needles, and it's working through that is just kind of, okay, so first of all, intellectually knowing what the needle is, right? So one of those tiny little needles can fit, there can be 100 on the top of a traditional hypodermic needle, right? And then working with your acupuncturist, you can massage the point first and use a point that's not really that challenging, right? You're never going to feel this point go in at all. And then that establishes trust when you're working with a patient. So maybe with, for example, our PTSD patient right now, we're doing trauma response work with her. Her first session, we only did ear seeds, right? So ear seeds also access acupressure, right? So the ear is a microsystem for the entire body, akin to those maps that you see in the foot massage places, right?
Yeah.
So we can access certain pain responses, certain organ systems, pain relief responses, stress relief responses in the ear. So maybe that is something where, okay, cool, the person just wants to try one acupuncture point, learn about acupressure, and then do the ear seeds to work on their pain response. Those pain response ear points are very powerful.
What is that sensation when, if you're getting, like sometimes when I get in my knee, like my lower, like by my calf,
Mm-hmm.
I'll feel this like shooting, like tingliness down
Yeah.
my, what is that?
Yeah.
Like that sensation? Like what causes that?
It's a nerve response. I mean, it's just really like, I mean, I could be all flowing robes right now and tell you that it's the chi moving down the channel, but yeah, it's the actual, it's like it's like a nerve response.
Yeah, it's
Yeah.
like, it's quick. It's just like,
Yeah.
okay.
Yeah. Yeah.
Yeah, I'm
That's
always
the pain
curious about what that
response.
is.
Yeah. Very cool. I love that. Yeah. People have different experiences with acupuncture too, right?
Yeah.
So, I've had people say they've had out of body experiences, or they've kind of woken up while they're on the table and felt the room spinning, but not in a bad way.
Yeah.
I have acupuncture points that itch when I put them in myself. So like it'll feel like an itchy crawly needle, like burny itchy. But generally speaking, at the end of a treatment, I wake up and I feel really rested and energized at the same time. So just giving yourself the time and space to actually just relax your nervous system
Yeah.
for a hot second, 30 minutes a week is really powerful when you have endo. Like, I mean, there is a trauma piece to this, right? There's an emotional component of having that much pain, and having to live and push through that much pain is really psychologically damaging too, right?
A lot of times when I'm sitting down or lying down for treatment, I'll notice like I'll wake up, I'll fall asleep and I'll wake up and I'll have like tears coming out of my eyes.
Yeah.
But I'm not
Yeah.
crying. It's just
Yeah.
like that's just
Release.
a response. Yeah, release.
Yeah.
Feels good.
Yeah. Yeah. It can be really cathartic.
Yeah. What what causes that? Like is that specific points or like just part of the healing process?
Yeah. I mean, w- well, there's certain points that can be very cathartic, like the one in the third intercostal space, Ren 17, has this really powerful. I don't think I've ever needled that point and had somebody not cry, for sure. Thinking about that as like a draining point almost, right? So it's
Yeah.
just like just kind of getting rid of and releasing that energy that's stuck in the chest. right? When we think about that.
Are there, just like to lean in more into the patient journey, are there any credentials that especially a patient with endometriosis should be looking for when they're looking for a practitioner?
Yeah, for sure. I would say this isn't the arena for dry needling. I'm just gonna just put that out there as like, don't go to I would say, an acupuncturist has about 400 hours of clinical training in acupuncture. And I would say I would never go to just an acupuncturist. I would go to an herbalist and an acupuncturist. I don't know. I think that this is just my personal opinion. I'm
Yeah.
California trained, which is a different type of training. We have to go through an extra, like a different board exam, and it's pretty intense. But I would say that like I would never just go to an acupuncturist. I would definitely take the herbs in concert with the acupuncture. And I would also say that, like, because of that training, we know not to, hit a lung space or I mean, it's just the depth. We know the exact depth to put the needle in to the tissue.
Yeah.
And so we have a little bit more training. I would say stay in your lane for sure. Like, just don't go to somebody that's like trained on a weekend course, like
Yeah.
on YouTube.
Are there,
There's
so
space for YouTube, but it's not acupuncture.
yeah, for sure. You want to anything medical.
Brain
Stay away from
surgery, maybe not.
Are there, like in looking for to kind of like red flag, like you said, the weekend train versus the California train, like you,
Yeah.
are there different ways to red flag it in terms of the like what people are charging?
Oh, no.
Or
No.
no?
No, absolutely not. No. But I would say this, like one cool thing, and I really actually like that our clinic does this. We've talked about like getting rid of this for a while, but like, man, I love it that we have 15-minute consults, right? So it's
Yeah.
like you can call anytime. Also, like once you become a patient with us, like I just did a lab review for somebody, for a couple, and we just jump on the phone with them. We don't charge you for our time like that. And I mean, that can be a fault. To a fault. We're pretty
Yeah.
accessible. But like if I was an endo patient and I wouldn't go to somebody that didn't have a consult, right? Because it's like you really want to be able to interview your doctor. It can't be a general acupuncturist. It has to be somebody that really has seen this before and has experienced this and like can really answer those questions and do the right testing if necessary, refer you out and is really embedded in that community.
That's amazing that you guys do that because
Yeah.
in years, I mean, I've gone to many different acupuncturists, but every single one of them, anytime I make a switch, there's a consult that's $150.
Yeah.
And it's like, okay, well, if I'm paying this for the consult, then I'm sticking with this person. Because
Yeah.
it's like I'm not going to go spend that again to interview somebody else,
Yeah.
essentially.
Well, what's also happening, which is great, I mean, it's like it's a two-way street, right? Because it's like we know whether or not, okay, cool, this person's going to be, we have a lot of history before we
Yeah.
even get to the initial visit. And so that really helps us too. I mean, both of us, we have two doctors at my office and we both do it and we both case share, which is great. It's very complimentary.
Yeah. And then you touched before on how important it is for the patient responsibility of what you do outside the office. Are there any lifestyle factors that specifically like we could dive into a little bit, like especially with dietary, whether it's like the anti-inflammatory diet, or gluten-free, dairy-free, like different nutritional approaches that you find are the most effective, complementary to the herbal remedies for women with endo.
I bet you could write the book on this though. Do you want me to you feel like I mean, I can mansplain this to this community all day long. I'm sure every single person on this call is like, yeah.
You'd be surprised. A lot of like what I've been kind of focused on lately is like nightshades and avoiding those. So that's it. Anytime the anti-inflammatory diet comes up, or I'll be out with like other women with endo and grabbing dinner or something, and somebody will order eggplant, and
Yeah.
it's like, oh,
Hard
well,
no.
it's like you think that's healthy and vegetable, or eggplant's a vegetable, right? Is that a stupid question?
Yeah. Yeah.
And it's like, no, there's nightshades, red peppers,
Tomatillos,
tomatoes,
goji berries. Yeah. Potatoes, believe it or not. There's
white
really, yeah.
potatoes.
Yeah. So there's a natural pesticide that occurs on nightshades that actually can create a flare, like an autoimmune flare. And we have so much luck, and people can feel it, like particularly in their joints sometimes if they're really reactive to it. But yeah, like thinking about AIP frameworks have been really successful at our office. I mean, I can't talk about that specifically for your space other than, yes, we've had good experiences with AIP. And then depending on that, if you are going to work with an acupuncturist, you want to really talk to them about if your tongue and pulse are hot, then we would incorporate more cooling foods in your TCM nutritional plan, right? Besides all of those processed foods. So I always say no gluten, no dairy for just for a while we're trying to get everything under control. And then just kind of seeing, like, do a true elimination diet and reintroduction to see what's actually flaring you, and just really notice what day. I would actually say that one thing that's important too is cycle tracking, right? Just having that awareness around where you are in your cycle, not just using a phone app. That's an antiquated algorithm, but something like a urine metabolite tester, so that you can really see what your hormones are doing and what that concentration of your hormones are doing. You really want to see what the estrogen levels are in the follicular phase relative to the progesterone in the luteal phase, right? If you have a really estrogen dominant follicular phase, then okay, well, what do you need to do to counterbalance that, right? What's the brake on the gas pedal of the estrogen?
Are there any techniques for movement? Because that's something too that I've noticed with like if I get my period and have really bad cramps, that's when my pain's the worst, is with the cycle. But if I lay on the floor and just kind of like shake back and forth, that helps. Or even just like holding on to the table, like pushing myself back and bending over, and just like rocking back and forth. Like, is there, like, what's the science behind movement and how that can help you during a flare?
Yeah. So really, honestly, I can only put it in TCM context for you, is that we really want to move blood as much as possible and create circulation, right? So this is why I love Arvigo for something like this, like that abdominal massage and working on that abdominal massage. Or even finding a Mercier therapist is very powerful for something like this. But yeah, trying to kind of really work on those adhesions and promote that circulation, so you're reducing that prostaglandin activity, right? As much as possible, getting rid of those prostaglandin products.
And then
shameless plug here. So sorry, one last thing. I will talk about the power of moxibustion, because if you have stasis due to cold, it can be so powerful to use moxa.
I love moxa. I started it like 2 years ago. Just once a month in appointments.
You brought up the ginger, which is very cool. And I love that. And so I didn't mean to like poo-poo the ginger right away, but what you can do is, if you get trained in how to do moxa therapy properly, you can take a little piece of ginger and put holes in it, and then put it on your abdomen, and then put the moxa cone on top of it. It's really, you can burn yourself. So you have to have a provider teach you how to do that. That's not a YouTube thing.
I didn't even know you could do that at home. I mean, I do it with my practitioner.
Oh, okay. Yeah. So we give people poles, moxa poles, like smokeless moxa that they can do. And then we train them how to do them on their lower abdomen. But yeah, moxa is full of flavonoids. So it's got this really nice activity, and the smoke allows the medicinal properties of the herb to get driven deeper into the dermis so that you can really reduce that pain response. I mean, moxa is really one of the most powerful things we have in this medicine for endo, I would say.
So then whenever I'm having the moxa done on my abdomen, I always fall asleep.
Yeah.
Is that, you think, a personal thing, or is there something there where it just relaxes you so much?
Yeah. Yeah, of course. Yeah, for sure. It definitely relaxes. It's amazing. We actually have we always get the partner involved with endo patients and try to teach them. They come in for a training on self-care, like acupressure, how to do moxa, how to do abdominal massage, so that it's not just there's involvement in the case of the person. If there is a partner, it just really connects the two people so that they know what the person's going through, right? It makes it more like a partnership and less like you're just holding on to the toilet in pain, like.
I know.
Just,
I haven't heard of any practitioner that I've been to hasn't done that, but that's a really good idea. I have a partner, and it was a couple years, like when we first started living together, he started seeing like my pain flare-ups and how bad they were, and he was just like researching like things to help when I was like in the rough of it one day, and I was on the floor, and he went downstairs and got cinnamon in a spoon. He's like, here's, I read online like cinnamon's supposed to help you, and I'm like, not just like a sniffle. Like, that's not how it works. It's not just like in the moment. But that's so helpful to know that like there can be training conversation done where the partner's learning how to help in the moment and day to day, and that whole self-care aspect.
Yeah, for sure. It's really powerful. And like teach them how to put ear seeds on and like the whole thing. Yeah.
That's amazing.
I love that.
We've covered so much ground, which I love, in a short amount of time. But before we wrap it up, just some key takeaways. Could you share just like the 2 to 3 most important things that you would want one with endometriosis to know about acupuncture before going to a practitioner, or who are already with a practitioner, just to make sure they're aware of as they go on this journey to take care of themselves?
Yeah, I mean, I would say, again, we've covered this a little bit, but make sure that they're board certified in herbs for sure. And also I would look for the ABORM certification as well. So that gives them an extra layer of reproductive health care. Make sure that you can interview the person, right?
Yeah.
Like they're going to be in your life for a long time. So make sure that that's the case.
What is ABORM? What does that stand for?
American Board of Oriental Reproductive Medicine. Yeah.
That's amazing. And then just any final piece of advice for somebody who's feeling a little discouraged and is thinking of acupuncture. It's like, oh, I'll give it a shot, but like doesn't have high hopes.
They don't have high hopes?
Yeah, of like a patient who, I mean, I've talked to many women who like, have you tried acupuncture or acupressure? And like, what is that really going to do for me?
Yeah, that's too bad.
Yeah, so it's advice for someone to...
Yeah, you have to have an open mind, right? Like, I mean, I fell out of a crane, my back was broken, and the guy made me walking again. So
oh my God.
Just like not really I would just say like, don't close yourself off to a different type of medicine, and don't get connected to it's reductionist to think like, oh, I'm just not going to try that. Like, why would you not try that? It's like, maybe you'll like it, or maybe you'll have a good experience. Like, try it. I know that you're really deep in it with endo and you've tried everything and you're just really discouraged. But you should approach everything with an open mindset when you're going into it. I mean, it's a really, I'll be honest, as a Westerner, it's a very strange medicine. And it's really hard to grapple with. I've been studying it clinically for 10 years. But we've seen it do amazing things, and it's really powerful, and it can be really transformative.
Such great advice, and you're so full a lot of great information.
Yeah.
So
lovely.
thank you for sharing your expertise with us.
Yeah.
Where can listeners find more information about your work and Mighty River Wellness?
Yeah, so we're online. You can always follow us on Instagram and TikTok and all the things under Dr. Beck Hoehn. And then for those of you that are trying to conceive, we are actually launching 2 courses on optimizing sperm and egg health next week for National Infertility Awareness Week, called the Make a Baby Bundle. So stay tuned for that. And we're going to be launching a couple of more digital courses for reproductive health coming up. So just kind of follow our channel.
Yeah, I love that name, Make a Baby Bundle. That's cute.
I know, it's really cute. Yeah, for those of our office people get those as part of their care. So they watch those and then we evaluate the patients, the couples together. So it's really, really nice.
That's nice and perfect for Infertility Awareness Week. Awesome.
Totally, completely.
All right, well, thank you.
Yes, thank you. And thank you so much for having me on. And I hope your listeners feel better. I'm rooting for you.